How do doctors test for food allergies in children? Breaking news for parents everywhere. The question on many minds today is, how do doctors test for food allergies in children? With allergies on the rise, understanding how these tests work is more important than ever. Parents are eager for reliable information to keep their kids safe and healthy. Let's break down the methods doctors use to diagnose food allergies effectively. The first step in testing is a thorough medical history and symptom review. Doctors ask about the child's symptoms and when they occur after eating certain foods. Family history is also important, as allergies can run in families. This initial discussion helps identify potential allergens and the nature of any reactions. Next, there is the skin prick test, a common method used by doctors. Small amounts of suspected allergens are placed on the child's skin, usually on the forearm or back. The skin is then lightly pricked to allow the allergen to enter just below the surface. If the child is allergic, a small raised bump will appear within 15 to 20 minutes. This test is quick and effective for detecting immediate allergic reactions. Blood tests are another option for diagnosing food allergies. These tests measure the level of specific immunoglobulin E antibodies to particular foods. Blood tests are especially useful when skin testing is not possible or when multiple allergies might be present. While they provide useful information, they cannot confirm the severity of an allergy. For a more definitive diagnosis, doctors may conduct an oral food challenge. This test is done under strict medical supervision. The child is given gradually increasing amounts of the suspected allergen while healthcare providers monitor for any reactions. This method is particularly helpful when other tests are inconclusive. Sometimes, an elimination diet is recommended. Doctors may suggest removing suspected allergens from the child's diet for a few weeks. After that, the foods are reintroduced one at a time to identify which ones cause symptoms. This process should always be done with professional guidance to ensure balanced nutrition. In cases of severe reactions, additional laboratory tests may be performed. For example, measuring mast cell tryptase levels shortly after symptoms begin can support a diagnosis. However, these tests are not typically used for routine allergy testing. For children with food allergies, maintaining a balanced diet rich in essential nutrients is vital for growth. It is important to avoid allergens while ensuring adequate intake of proteins, vitamins, and minerals. This often requires careful planning, sometimes with the help of dietitians. Managing picky eaters with allergies involves introducing safe, nutritious alternatives and keeping an eye out for any new reactions. In all cases, testing and diagnosis should be guided by pediatric allergists or immunologists to ensure safety and accuracy. This careful approach helps families navigate the challenges of food allergies while supporting their child's health and well-being.